Blake Schwank with CCS IT Pros. One of the challenges that we run into and that we see a lot with critical access hospitals is that a lot of times they're in rural places in the United States. There's hundreds of critical access hospitals. The most of them are somewhere in the flyover states. You know, you get between Chicago and LA, and there's a lot of nothingness out there. And if you're in Fruita, Colorado, or Cody, Wyoming, or Hiawatha, Kansas, how do you staff your hospital? I mean, there's 33 critical access hospitals in Colorado. There's 40 plus in Montana and 80 in Nebraska. And a lot of them are in really rural areas where it's hard to find good talent. And you know, the challenge is you can find a lot of times a technician, a desktop technician in these areas who can do the work, but you also have other requirements if you want to run a good network, if you want to be secure, if you want to be compliant. You need like 10% of a network engineer. You might need 25% of a systems administrator. You need somebody that understands voice over IP. If you don't have somebody that understands how to properly run cabling and set up a network closet, you run into disasters like this or like this that we see when we go and we talk to these hospitals. And these things happen over time and not immediate. But you know, you also have access control. You have video surveillance. These things are hard to maintain. And so while you can maybe find a desktop technician in these places, because you really need the boots on the ground, you know, if a desktop technician, maybe 100% of the time, you might need two of them if you've got a 25, 30 bed hospital. But if you go, say, you know, we run into places where they just go hire somebody that's really big and they have them work down. Now, a system administrator, a network engineer can definitely do the desktop support, but they're not happy with it. Imagine if you had a provider and you had them work down. They can in a pinch. They can do CNA work or something like that, but they really don't want to, and they won't be happy long time, and they won't stay long term. And if you don't give them work to do, then you end up with someone tinkering with your network because they don't have enough work. And we run into that too, where the network is somebody's playground, and then they over-engineer it and they make it custom to them. And then it's really hard to work with if anybody else comes in after that person leaves. So with CCS IT Pros, what we can do is we can provide you, and what we provide our critical access hospitals and our remote healthcare clinics is a little bit of everything they need in little bits. So we can provide that 10% of a network engineer. We can provide that 20% of a system administrator. We can manage the voice, your access control. We can do the cabling properly and make sure it meets fire code, make sure that it's stable so you don't have an outage on your network. We can have that cybersecurity person that you only need 20% of a cybersecurity engineer, and we can provide that to you so that you can make sure that you're compliant with all the requirements that you have to pass in your security risk assessment and to keep your patient's data safe. So if we can help you staff your critical access hospital, let us know. Give us a call here at CCS IT Pros. We're experts at this. You can find us on the internet at www.ccsitpros. You can call us at 719-439-0599. And so thank you for all the hard work you do out there. We know it's very hard when you don't have a full, easy access to staff if you're in a town of 10,000, but we can help you. We've got access, and we employ all the techs that you need to operate your hospital and keep your patients safe. So reach out to me if I can ever be of assistance to you. Have a great day.